I am at Lakewood Hospital today to go inside and find out about an exciting new grant Lakewood Hospital received to help women in need get mammograms. We're going to talk to their radiology department and learn about this grant, as well as the technology behind mammograms themselves.
Through our affiliation with the Cleveland Clinic, Lakewood Hospital received a $100,000 grant from the National Breast Cancer Foundation. And because of the grant money that we received, we decided to establish the HOPE program at Lakewood Hospital. The HOPE program benefits women who are uninsured. They are at least the age of 40 or older, and they cannot have had a mammogram in the past 12 months. Any patient can call from the east side of Cleveland, west side of Cleveland, and we can accommodate that patient.
I am here with Judy, the lead mammographer at Lakewood Hospital, and Judy is going to teach us all about the technology behind this machine here. So tell me a little bit about this, Judy.
This is a mammography unit. When we have patients come in, we usually take 4 pictures, 2 of each breast. They will stand facing the machine. I have control with the compression paddle with my foot, but I can also control it with my hand. So if women are having a little hard time with the compression, we can go a little bit slower.
Which I know sometimes, women come in here, and we talked about this, they're a little bit nervous, so that kind of helps ease that a little bit to be able to do it by hand.
Absolutely, absolutely. First-time patients especially are very fearful when they come in.
So I know that women typically get a baseline exam between 35 and 40. So what does that do, and what does that set them up for that this machine will see?
The baseline mammogram, like we said, we take 2 pictures of each breast. That's going to be their baseline. Once they hit 40, they're going to come in every year and have another mammogram done. And those mammograms are going to be the baseline to the future mammograms. So it is real important to have them between 35 and 40.
So what does this machine actually do? Is it an actual X-ray of the breast?
It's an X-ray machine. We actually put a plate in here that has film in it, and X-rays go through the breast and cause an image onto the film.
And then what do you see? What's normal? You'll then look at those almost, I would imagine, develop them, right? And then look at them and look for abnormalities.
Actually, we develop them, and as a mammography tech, I make sure I have all the breast tissue, that I have no wrinkles, no folds, no motion. And then we leave the rest of the work up to the radiologist.
So is that why they have you have to hold your breath when this is going on?
Absolutely. If you breathe or move, it's going to cause a little bit of motion. So we always make sure we check for that.
So is this actually just an X-ray machine then?
It is an X-ray machine, yes.
Okay. And then so once you have someone that comes in after 40 and they're coming in every year, you just look at those films next to each other each time?
Absolutely. I compare back to make sure I'm getting all the breast tissue as we did when they were first here. And then again, those are hung for the radiologist who compares the films and makes sure there is no changes. If there are changes, then we bring them back and work up those changes and make sure it's not anything that needs further attention.
For women who are scared, I think it's just coming in. We're really good about showing them the equipment, making sure we talk to them about early breast detection, and making sure they're really aware of how important getting a screening mammogram is.
Well, the mammogram will see things that you cannot feel. So that is the importance of the mammogram. Early detection is the best protection. And women, we're seeing cancer younger and younger in them. So get in here, get those mammograms. Let's make sure you're okay.
As long as we have the grant money available, that patient can come back each year to have a screening mammogram done. And the number to call is 216-529-7229, and we can help that patient schedule an appointment. All the paperwork is taken care of. The patient has to do nothing but come in and get their exam.
And we're seeing cancer at younger and younger ages, and women want to take care of themselves. That is a fact. So I am just thrilled to see the looks on their faces when they come in and know I can have this done and I'm not going to have to pay for it. They're having a hard enough time. People are laying off every day, and that's the majority I'm seeing. I've done 10 mammograms so far on these women, and probably 8 of them have lost their jobs or their husbands have lost their jobs. So there is a need for it.
For Talkin' Tech, I'm Stacy Schaefer.